discussing today is about the very important issue of protecting children from COVID-19, and in particular focusing on making schools and childcare safer. And Greg Kelly is going to speak to that document.
Hi, good afternoon, and thanks very much for joining us, everyone. As Richard said, my name is Greg Kelly. I'm a paediatric ICU specialist, paediatrician and AusSage member, and I'm dialing in from Bidgeville and Gadigal country in Sydney and talking about the AusSage work and document protecting children from COVID-19 and making schools and childcare safer. I'm really going to cover 3 issues. 1, can we protect children from COVID? 2, should we? And 3, if so, how? And so to the first question of can we protect children from COVID-19 and make schools and childcare safer, AusSage recognises the benefit of face-to-face learning for children, their families and the community. But this is often presented as a trade-off that in order to get those benefits, we must accept much higher rates of COVID transmission in this age group and that many kids will just get it. But in fact, that's not the case. It's clear that face-to-face learning can happen whilst simultaneously protecting children and the community from COVID-19. And I'd like to use the example of the UK on one hand and San Francisco on the other to demonstrate this. So when the UK returned to face-to-face learning earlier this year, they had no vaccination in place for 12 to 15-year-olds. They had no masking and they had no attention to indoor air. And by every measure, the UK return to school has been disastrous. So last week, an astonishing 1 in every 20 high school students in the UK tested positive for COVID in a single week. And however, the following week's data was even worse, 1 in 15. So an extraordinary 1 in 15 high school kids are getting COVID every week in the UK. Between 1 in 10 and 1 in 20 are off school at any time for COVID-related reasons, and their overall absenteeism in the high school group is 15%. So almost 1 in 6 students absent at any time. There's a high but as yet unknown burden of long COVID. Suffice to say that the NHS has opened 15 child-specific long COVID clinics, and of course the UK COVID situation for the whole community is also a disaster with 1,000 deaths per week and over 800 people on ventilators. It's helpful to contrast that to San Francisco, also returned to face-to-face learning some months ago, but had some important differences. Very high vaccination rates in the 12 to 15 age group, attention to safe indoor air and the other hierarchy of controls that Kate mentioned, and universal masking for teachers and students. And San Francisco, by contrast to the UK, has had just 7 in-school transmissions since April. So it's clear that it's not about whether schools are open or not, but whether they are open safely and what measures we've taken to do that. And it is actually worth noting that the UK is now moving quite late to checking the indoor air quality and installing CO2 monitors in their school because they're recognising that their approach is clearly not working for the students, for their education or for the community as a whole. So in answer to the first question, can we protect children? The answer is a definite yes. The second question is, should we protect children? There is an apparent controversy about children and COVID at the moment, where on the one hand, we have experts saying that COVID is generally a mild illness in children. They usually have relatively mild symptoms and recover quickly. And on the other hand, we have scenes in the US and Canada of overwhelmed paediatric hospitals and ICUs. And there appears to be an apparent controversy between these two positions. Actually, there isn't a controversy. COVID is generally a mild illness in children and they are less at risk than adults, but there is no doubt that children can get COVID, can transmit it, can get sick from it, including long COVID, and can even die. And because children are the largest single unvaccinated group and all get together in small, poorly ventilated places, which we call classrooms, as Australia moves towards opening up, we expect the cases in those younger age groups to go up. And I saw the data that Richard presented earlier that now a full 42% of cases are in the under 30 age group. So that younger, more mobile and less vaccinated, or not at all vaccinated, less than 12 age group, we're going to see an increasing number of cases. So while people are correct in that they say that only a small number of children get seriously unwell, even a small number of the very large number of children that we expect to get exposed becomes very important. The second point is that our child health system is much smaller than our adult health system because children rarely get sick from anything, COVID or anything else. And so while 1/4 of our Australian population is 19 or less, only 6% of our national ICU beds are allocated for that age group, which just shows the relatively lower likelihood of children getting sick from anything. And this goes further to explain how a small absolute number of sick children can easily overwhelm our small child health system. Long COVID in children remains uncertain and controversial, as you would expect for a chronic illness from a virus that's only been around for 2 years. But it is clear that children can get long-term symptoms, can meet the criteria for long COVID. I mentioned the large number of clinics that the NHS has set up for children, and remembering that children have many decades of life ahead of them. So even a mild impairment over a long lifetime becomes enormously important for that person and for the community. And so to the answer of should we protect children, again, the answer is yes. The third question is how can we protect children? And Kate actually went into this with a lot of detail. And unsurprisingly, because children are of course human, like people in workplaces, the things that we do to protect children in schools are very similar to the things that we can do to protect people in workplaces. And again, it's worth noting that the places that people gather are schools, homes, and workplaces. And we know that COVID is an airborne disease, and really in some ways is a disease of buildings. And so we need to pay attention to the places where people, especially people from different groups, get together. And so AusSage has practical, cost-effective advice on protecting children and making schools and childcare safer, which is based on the most up-to-date science, has been proven in many places around the world, and much of which can be implemented in the very near future or even today. And it really comes down to the 3 V's, which are vaccinations, vaccines plus, which includes masks and other measures I'll go into a bit more detail on, and ventilation or safe indoor air. The concept of a hierarchy of controls or layers of mitigations that Kate mentioned is very important. The number of layers depends on the level of community transmission. Our AusSage document goes into how to assess the level of risk in the community and how different responses will be appropriate for different levels of virus. Masks are a critically important measure. We just last week heard the Victorian announcement about bringing in masks for grade 3 and above. AusSage strongly recommends masks for all school-age children and recommends where developmentally appropriate for younger children than that. We've seen examples from around the world, including New York and San Francisco, which I mentioned earlier, as well as Asian countries like Hong Kong and Singapore, which have masks for even young children and have shown them to be very effective at reducing transmission. Masks are really you get double effect from a mask because it both prevents the person with COVID from breathing it out, as well as prevents an uninfected person from breathing it in. So it's really a 2 for the price of 1 with masks. Attention to safe indoor air, testing the quality of indoor air and improving it either through natural or mechanical means, and where not possible, filtering the air. Vaccination of everyone that's eligible, which as we know at the moment includes all adults, teachers and children down to 12. Hopefully in the next few months, we'll see a vaccine for the younger age groups as well. And important attention to scheduling, teaching classes outdoors, having staggered classes where possible. A key part of the AusSage recommendation, 2 key parts are 1, allowing parents to decide when it's safe for their child to go back to school. Every family's risk assessment will be different. We advise that governments shouldn't mandate children to go back to school, but should allow parents to decide when it's safe for their family to go back to school. And finally, the importance of protecting kids' mental health through this great uncertainty that comes with the pandemic, not just around disruption to schooling. Thank you.